So to say it as plainly as I can, health care is the single most important thing we can do for America's long-term fiscal health. That is a fact. That's a fact. It's a fact, and the truth is most people know that it's a fact. And yet, as clear as it is that our system badly needs reform, reform's not inevitable. There's a sense out there among some, and perhaps some members who are gathered here today of the AMA, that as bad as our current system may be, and it's pretty bad, the devil we know is better than the devil we don't. There's a fear of change, a worry that we may lose what works about our healthcare system while trying to fix what doesn't. I'm here to tell you I understand that fear, and I understand the cynicism. There's scars left over from past efforts at reform. After all, presidents have called for healthcare reform for nearly a century. Teddy Roosevelt called for it, Harry Truman called for it, Richard Nixon called for it, Jimmy Carter called for it, Bill Clinton called for it. But while significant individual reforms have been made, such as Medicare, Medicaid, and the Children's Health Insurance Program, efforts at comprehensive reform that covers everyone and brings down costs have largely failed. And part of the reason is because the different groups involved, doctors, insurance companies, businesses, workers, and others, simply couldn't agree on the need for reform or what shape it would take. And if we're honest, another part of the reason has been the fierce opposition fueled by some interest groups and lobbyists, opposition that has used fear tactics to paint any effort to achieve reform as an attempt to, yes, socialize medicine. Now, despite this long history of failure, I'm standing here because I think we're in a different time.